Now let's talk about what it looks like if a woman decides to get an epidural during transition. So usually transition is a pretty intense part of labor, but for a lot of women, this is when they do opt to have medical pain relief, whether they were planning it or not. And so we're just going to kind of go through what that process looks like so that it's less anxiety provoking for you and your partner in the moment. The first thing that would happen is that you would be consented for the epidural. Sometimes that happens as soon as you're admitted to the hospital, and sometimes that won't happen until you're actually ready to get the epidural. It kind of depends on hospital policy. After you did the consent, which would involve the anesthesiologist discussing the risks and the benefits of the epidural, then you would basically start the process of actually receiving it. And you'll have to sit on the edge of the bed and basically curl forward like this to expose as much of your spine as possible. You will have to stay as still as possible, but usually the anesthesiologists are pretty good at telling you when they're actually getting ready to put the needle in, so that if you need to move during a contraction, that's okay, and then they'll just try to work quickly in between contractions when it's easier for you to stay still. When they start the process of giving the epidural, your partner, and if you have a doula, may be asked to leave the room. That also depends on hospital policy. So some places will let them stay in the room and support you during those contractions. Other places will ask them to leave, but usually if that's the case, you're in good hands with the nurse who will help to keep you calm during contractions. So then basically between a contraction, they're going to insert a needle into your lower back, which contains a cannula, which is basically a really small tube that will ultimately administer the medication. So the needle itself doesn't actually stay in your back. Once the cannula is in, they actually remove the needle, and then the cannula is actually hooked up to tubing, which will be hooked up to a bag of medication and a pump. And so the pump will basically infuse that medication continuously. Most anesthesiologists will also give a loading dose initially, which will help to give you pain relief more quickly. So they'll give you some medication as soon as they administer the epidural so that you can kind of have immediate pain relief, which usually happens even as fast as within 5 minutes or so. And then as time goes by, women get more and more relief as the infusion basically starts to kick in better. So when you first get it, you'll have to remain on your back. You can sit up and be kind of semi-reclined, but you shouldn't be on either side because they'll want that medication to basically distribute evenly to both sides of your body so that you don't have any patches that are not covered well by the epidural. But then usually after about 30 to 60 minutes, you can start to change position more. So you can be on your side, you can sit up, whatever is comfortable and seems to be kind of helping labor to progress. It's also important to remember that even though the epidural takes away pain, it's not going to take away pressure. So as the baby gets lower and lower in your pelvis, you probably will start to feel a lot of pressure, and that's completely normal and will actually help you to push your baby out when it's time.